Welcome to the deep dive. Today, we're taking a closer look at the male genitourinary system.
Yep, we're using medical guidelines as our framework here.
We'll be touching on, what's considered normal, how to do self-checks, puberty, aging, and even a bit about some STIs.
Right. The aim is really to cut through the noise and give some clear, useful information, practical awareness for your health.
Exactly. So, where do we start? Maybe with self-examination.
Good place to start. Testicular self-examination, or TSE. It's pretty important.
Okay, so how often? The guidelines usually say, what, once a month?
That's the recommendation, yeah, once a month. And there's a simple way to remember how. TSE, time, shower, examine.
Time, shower, examine. Okay, so time is once a month. Shower.
After a warm shower or bath, ideally, the heat relaxes the scrotum, makes it easier to feel things properly.
Makes sense. And examine. What exactly are you doing?
You gently roll each testicle between your thumb and fingers. You're feeling for the surface, the consistency.
And what's considered normal? What should you expect to find?
Well, the penis itself should be smooth. No lesions, no discharge. The scrotum might hang a bit unevenly, totally normal. Usually the left side is lower.
Okay.
And the testicles themselves, they should feel firm, kind of rubbery, smooth, and roughly equal in size. No pain when you touch them, no swelling.
Like a peeled, hard-boiled egg, maybe, but firmer.
That's a pretty good analogy, yeah.
Yep.
A bit firmer than that.
Got it. So conversely, what are the red flags, the things that mean, okay, maybe I should get this checked?
Definitely any new lumps or bumps you feel on the testicle itself. Also swelling, pain, redness in the scrotum.
Anything else?
Yeah, any soreness or discharge from the penis, or any hard lumps along the spermatic cord, that tube leading up from the testicle. Finding these things early is really key.
Right. Early detection can make a big difference. Okay, so moving on from self-exams, puberty. That's a big period of change.
Huge changes. We often use the Tanner stages to describe it. It's a scale, basically.
Stage one is before anything starts, right? Prepubertal.
Exactly. No real pubic hair. Genitals look like a child's. Stage 2 is where you first see some light, sparse pubic hair, and the testes and scrotum start to enlarge a bit.
Okay, then stage 3.
Hair gets darker, coarser, starts to cover more area, and the penis begins to grow in length.
And stage 4?
Hair looks more like an adult's, but maybe not quite covering the full area yet. The penis grows in width now, thickens up, and the scrotum usually gets darker in color.
Right. And stage 5 is full development.
Full adult appearance for hair and genitals. It's a process, happens at different times for everyone, but that's the general sequence.
Good overview. Now, change doesn't stop after puberty, does it? What about aging, say 30s, 40s onwards?
No, changes continue, though often more subtly. You might see a gradual decrease in testosterone levels and sperm production starting around then.
But fertility doesn't just stop.
Generally, no. Fertility often continues for many years. But physically, you might notice less pubic hair than before. Erections might take longer to develop. Ejaculation might be, well, less forceful. The testes could decrease slightly in size or feel a bit less firm.
And what about the prostate? That comes up a lot.
Right. The prostate gland can enlarge as men age. It's very common, called BPH, benign prostatic hyperplasia. It's not cancer, but it can sometimes cause issues with urination because it squeezes the urethra.
Good to know. Okay, let's touch on STIs. The sources mentioned a few examples. Genital warts.
Yeah, caused by HPV, human papillomavirus. They tend to be painless, flesh-colored little growths. Sometimes they look sort of cauliflower-like.
And herpes, genital herpes.
That's usually HSV2, herpes simplex virus type 2. It typically causes painful little blisters or ulcers, often in clusters. The first outbreak can sometimes come with flu-like symptoms too, and it can recur.
Right, it can't come back. Okay, one more example mentioned was chancroid.
Chancroid. That's a bacterial one. It causes a really painful ulcer, often with kind of ragged edges, and you can get swollen, tender lymph nodes in the groin that might even drain pus. Less common maybe, but important to know.
Okay, so quite a range of things there. So let's just quickly recap. We covered monthly self-exams, the TSE method.
Time, shower, examine, knowing what's normal versus abnormal finding.
The Tanner stages for puberty.
The typical progression.
Changes that come with aging, like hormonal shifts, prostate enlargement.
Yeah, the BPH possibility.
And finally, a quick look at a few SPIs, like HPV warts, herpes, and chancroid.
Exactly. The big takeaway really is just being aware of your own body, knowing your baseline.
Yeah, recognizing changes.
And not hesitating to talk to a doctor or a healthcare provider if something seems off or you have concerns. Don't wait.
Absolutely. So maybe a final thought for everyone listening. How can knowing this basic information empower you? Does it make you think differently about maybe starting those monthly checks or seeking out more reliable health info?
It's about being proactive, isn't it? Taking that first step towards understanding your health really can make a difference down the line.